Thank you. Dr. Srinivasan is the visiting professor, Shivaraj Homeopathy Medical College, Salem, the speaker in various conferences in Canada and India, practicing at Chennai and Salem, India, visiting then 22 years of experience. The subject is nurse fever. We know the importance, the role these two, the fellows, Constantin Herring and his friends played in homeopathy in America especially. So on behalf of IFPH and welcome Dr. Srinivasan, you can have the platform for the next 45 minutes. It's over to you. Please proceed.
Patient says very few symptoms or seemingly common symptoms. In a casual look, it appears these are common, but nothing is common. When we very carefully observe, listen to them, see, examine, when common things are put together, they form a fantastic characteristic. Suppose a homeopathic practitioner is there with a clinic in a village, a small place, or even in cities or towns where patients come and say only very, very few information. Can I have exact reference in some repertory or materia medica and prescribe a remedy with reasonable success? This is one question.
Excuse me, sir. Excuse me, sir. Could you please be a bit louder?
Yes, sir.
Okay.
So, when patient says very few symptoms, seemingly common, can I have exact reference, prescribe a remedy, and give reasonably good successful result? This is the first question. Yes. And what is the resource for that? It is KNERR'S repertory. KNERR'S repertory is a repertory of Herring's guiding symptoms. Herring's guiding symptom materia medica is 10 volumes. And all that content is made into a single repertory, and that is KNERR'S repertory. Indian practitioners largely use the previous generation, even today, Allen's keynote and Boric materia medica, largely. So Allen's keynote is further condensation of Herring guiding symptom, and all that we see in Allen's keynote, you will find exact reference in Herring guiding symptom materia medica. So now let us see, patients say very few common expressions, casual expressions. Can I find exact reference in KNERR'S repertory, give the remedy and produce result? So case number 1. Patient says, I have severe neck pain whenever I get chills. I am having chills now and I am having neck pain. That's all. No etiology, no location, sensation, modality, concomitant, extension, nothing. Patient says only this much. Neck pain, back of neck with the chill. Okay. Now, in KNERR'S repertory, there is a chapter called fever. Subchapter is chill. Rubric is neck pain in back of neck. That is, during chills, patient have neck pain, the concomitant. Let us see what exactly. You can write down the remedy that comes to your mind. Chapter fever, subchapter chill, rubric is neck.
Please say sir, once more.
Chapter
Yes,
fever,
chapter fever.
subchapter chills.
Pardon,
You click open fever.
Yes, okay. Just a minute. Fever.
In the top of the page itself,
PEF fever. Yeah, fever.
You go to the top of the page, sir. Top of the, or top of this page.
Yeah. Then
The chapter is fever chapter, correct?
fever chapter. I have to take fever chapter, isn't it?
Yes, you open fever chapter only.
Fever. Fever. Yeah, fever. From, isn't it? Typhoid with from.
Okay. Now, otherwise, we will do one thing, sir. Don't just you just show me only the case page, Word document. I will just talk out. No problem. Just share only the. Now, okay, right. Now, I'll just tell you one thing.
Sir,
Just
please wait, sir, please wait. Dr. Aravindakshan mentioned that he will help you. Dr. Aravindakshan. Dr. Hubert, please make Dr. Aravindakshan co-host.
I can stop share. Okay.
Yes, please
Aravindakshan.
make Dr. Aravindakshan co-host.
Aravindakshan. Okay.
Yes, Dr. Aravindakshan, now you can share.
Yes, sir. Sir,
Please.
Srinivasan, sir.
Yes.
Am I audible to you, sir?
Yes, Aravind.
Sir,
Nice
good
to see
evening,
you
sir.
after
Meeting again. So I need a small introduction. He is one of my best mentor and best guru who teach me for every single dose medicine. Okay. So I am too using the repertory. So as sir said, Manoj sir, is the screen is visible for you?
Yes, sure. I think you can put in large.
Okay, let me go. The chapter is over here, fever. The main chapter is chapter number 40, fever. You
Yes.
should go to the rubric as chill, and in forward you should go LQ, and then you should go around as
neck.
neck. Is this everyone is visible over this neck?
Yes, good.
Fine.
The rubric is pain in back of neck.
Pain
There
in back of neck. The medicine.
Ailanthus. Okay. So patient tell us very casual expressions. We need to be sensitive and alert and catch things which are seemingly casual, seemingly common. Actually, what this component is concomitant. During chill, pain in the nape of neck. Patient may tell this in just 10 seconds. Okay. So on giving ailanthus, chills is gone, neck pain is gone. Patient did very well. Okay. So next case. I will just, Arvind, you just stay in the repertory page.
Yes, yes, sir.
I will read the case and then tell the
Okay.
rubric. Then we will show in the screen.
Okay, sir.
The rubric. Okay. Now,
Okay, fine, sir. I am with you, sir. I am with you.
case number 2. Patient says, body feels very, very, very hot after doing unusual warm-up exercise, which I do for playing shuttlecock. On that day, I did unusual warm-up exercise. Then I developed this heat in the body. Okay. There is no diagnosable fever, but there is intense heat in the body. Now, the patient tells it casual. Now, the reference is fever chapter. Subchapter is heat. So please open fever chapter. In that you find subchapter heat. In subchapter, you find the rubric exertion. Exercise after. So this can be used in fever with chills, fever, sweat, where the heat is component. and non-intermittent fevers also. Okay. Patient says my body is very, very hot. It is not fever, but I have this, and that heat or fever came up after overexertion. So the remedy is a spongia. On giving spongia, the fever is gone. Patient says things so casually, and we can find exact reference. Case number 3. Patient comes with fever and doctor, my heartbeat is very fast during my fever, nothing else. So heartbeat during fever is a functional concomitant. See, carefully let us see. I am not emphasizing on fever investigation, fever diagnosis, or pathological names. It doesn't mean that I am ignorant of pathology. I am not bothered about diagnosis. Wherever it is needed, I take the help of allopathy doctor to investigate or come to a diagnosis. And the role of that is quite small. I try as much as possible not to include the diagnosis in repertorization or in totality. Simply because if those components are included in totality or repertorization, the result percentage is usually weak. Say, for example, if I include typhoid in my repertorization and prescribe a remedy on that basis, it is usually less than 10% success. Without including the pathological name or diagnostic name or disease name, if I use a functional totality, a concomitant totality, the result percentage is somewhere between 70 to 80%. So that is the reason why I try to avoid using pathological names, diagnostic names. It has its own role, but only very, very, very small. And I don't even say prognosis also. My role is to find a similar remedy from the totality, give it, and watch carefully that patient improve, patient feels better. So that is the object. Okay. So here, case number 3, patient says, I have fever, and with fever, my heartbeat is very, very, very fast. So here, another important lesson. Fever is common. Fast heartbeat is common. Whether these two together can form a characteristic, can form a rubric, can form a remedy which is there in that rubric. Let us see. Okay. So chapter is fever, subchapter is fever, and the rubric is palpitation. See? So this is one very important lesson I have learned. Everything what patient says definitely has a role in forming a totality. Don't judge that this is common, this is unusual, this is peculiar. So even the most commonest thing is a component of a characteristic. This is one very important lesson I have learned. So chapter fever, subchapter fever, rubric is palpitation. And there you find the remedy, spigelia. On giving the remedy, spigelia. So in the discussion, what I want to say is, the idea of today's talk is about NERR repertory and hearing guiding symptom. Don't bother about potency and dosage. There is no secrecy about it, but focus is on NERR repertory and hearing guiding symptom. Okay. So on giving spigelia, see, these are seemingly casual expressions of a patient. If I am not alert, if I am not sensitive enough, if I am not prejudiced, these things will escape from my notice and I may miss the remedy and I may be doing more and more pressure job with patient as well as myself. Okay. So that is a beautiful reference. Then case number 4. Patient says, doctor, I have fever and pain in my head, in the back of my head. That's all. I ask so many questions about emotional cause, physical cause, the incubation period, any other physical generals. Nothing is coming up. Patient says very casually, with fever, I have headache in the back of my head. Is there exact reference? See, I am not using any specifics. I am not using any favorite remedy. I am not telling you any high grade remedy or 3-mark remedy or favorite remedy or intense remedy or any other author told give this and that remedy. Nothing. All very plain language. And also, one more thing I want to emphasize here. What I do is translate. I don't do any interpretation. There is a thin difference between translation and interpretation. And people who you come across all speak Malayalam. So where I see patients, they all speak Tamil. And what exercise that helped me greatly in acute cases as well as in chronic cases, I refer Tamil to English dictionary. So I recommend that the beginners, interns, young doctors, all of you, please keep in your dictionary clinic table, Malayalam to English dictionary. Our patient talks so easily and so expressively in mother tongue. And this has helped me a lot. Number 1. Second thing, English to mother tongue. Sometimes I know some word, but I want to be sure patient is telling exactly the same thing. So I verify. If I am very careful in small steps, my result percentage is high. If I am casual in such steps, my result percentage naturally drops down. So keep English to Malayalam dictionary also on the table. I do this in English to Tamil dictionary, I refer. Number 3, medical dictionary. And number 4, thesaurus. Thesaurus is one where for one English word, many common, probable, synonymous words are given. Because what patient says, we may think of one word and it may not be there in repertory. But if you see the synonym, the exact word will be there in the repertory. Okay, so here another exercise which I personally used and found very useful is using dictionary. Mother tongue to English, English to mother tongue, and medical dictionary and the thesaurus. Okay, so patient may say things very casually and we require exact translation and not interpretation. There is a huge difference. So I don't interpret, rather I translate. Okay, case number 4, as I told you, patient says, with fever, I have headache in the back of my head. So the reference is fever chapter, subchapter fever, headache, occipital. The exact reference is there. Fever, headache, occipital. You will be surprised to see that such things are there. The remedy is coca. On giving coca, headache is gone, fever is gone. And one more thing I observed when I prescribe acute remedies in such acute situations, very quickly, very quickly, even within 1 minute, result comes. Number 1. Maximum I wait for 6 hours, not more than that. Okay. So the result should come within that time. If not, either my potency is wrong or my dose is wrong or remedy is wrong. These are three commonest thing, I think. When I am sure the remedy is right, I either change the potency and adjust the dose. If I think my remedy is wrong, I do re-study of the case, do re-totality and prescribe the next remedy. Okay. So on giving the remedy, I wait for maximum 6 hours in acute cases. That is point number 1. Point number 2. What happens after giving an acute remedy? Very commonly, the most intense symptoms begin to reduce immediately. If the remedy is right, please note, the most intense symptoms begin to reduce very, very, very quickly. Third thing is, it is accompanied by improvement in energy level. The energy becomes better and better and better gradually. The fourth point is, patient, any one physical general will improve. It may be appetite, it may be thirst, it may be sleep. Okay. So I look for these things after giving a remedy in an acute situation. The result will come within 1 minute or maximum 6 hours. The more intense symptoms will begin to reduce. The energy level will improve. Any one physical general will improve. All this should happen within 6 hours. Then I am sure it could be even mental peace. It could be sweat if there is fever. Any of these physical generals or even mental generals. Patient feels more calmer. Patient feels more enthusiastic. All these things bringing balance in the system. So that is the idea. Okay. So case number 5. So patients say things very casually. So it is a very, very vital lesson I have learned. Don't be prejudiced. Be open to whatever patient says. Listen very carefully. Observe very carefully. Be intent. And what is seemingly common when put together may form a fantastic characteristic, and you have a direct reference. Another advantage, I have a challenge remembering materia medica. It is difficult for me because when patients say something, connecting all this and coming to a remedy and showing the reference. This is there in Allen's keynote in this remedy. This is there in Kent's materia medica under this remedy. This is there in Haniman's chronic disease materia medica, this remedy. It is very, very, very difficult for me. So I have to find a solution. The solution is, if I know what is a repertory, what are the chapters, how the repertory contents are constructed. If I know how it is constructed and how to navigate when patient says something, in which repertory I have to see, in which chapter I have to see, where I have to see. If I remember this ground plan of a repertory, then a bird's eye view, the navigation technique, that is really enough. And also the advantage is, this is reproducible by any student or any doctor. Like materia medica demands extraordinary memory. But this kind of repertorization, even a basic fundamental student of first year, second year, third year, final year intern can also reproduce. Patient says very small little expressions, connect it and find the exact reference in one book in a very plain way and give a remedy, you find that it works so wonderfully. No interpretation, no need of extraordinary memory. Okay. Case number 5. Patient says, doctor, I have fever, loose motion, and I feel very tired. Casually, it looks so common and there is no characteristic about it. And a casual look. Now let us see whether these 3 components are there in one rubric and what is the remedy. Okay. So the reference is fever chapter, Subchapter fever, rubric weakness in diarrhea. Exactly. I am not at all interpreting anything. Patient says something, I am merely translating and constructing a rubric out of it and trying to find exact match in the repertoire. Fever, fever, weakness, diarrhea. The remedy is sulfur. No remedy in homeopathy is acute. No remedy is chronic. Calendula could be constitutional. Aconite can cure a chronic cancer. Sulfur may act for 1 minute and then it will not act. Okay. So this is another very, very, very important practical lesson I have learned. Please try it in your practice. There are masters who taught acute remedy, chronic remedy. With due respect to all their experience and teaching, just to see whether, yes, this is possible. Can aconite cure a cancer if it is indicated? Will sulfur act only for 5 minutes? Then it will not act at all. This is also there. Okay. So fever, weakness, diarrhea, sulfur. On giving sulfur, diarrhea stopped, weakness is gone, fever is gone. And another practical technique which I found very, very useful, where either acute disease or chronic disease has episodes. Say, for example, patient has episode of vomiting, episode of diarrhea, episode of headache, episode of urination. Okay, where such clear-cut, sharp, intense episode is present. How to use it in practice? So what I do is, if patient says, doctor, fever is continuous, weakness is continuous, I get diarrhea once in 2 hours. So instead of giving any formula repetition of the dose, what I do is, I say, you take 1 dose medicine now and 1 dose after every diarrhea. Please follow this. Where an episode is present, convulsion is there, headache is there, diarrhea is there, vomiting is there, pain spell is there. Where an episode is there, whether it is acute or chronic, I use it to adjust that dose. So when I give 1 dose now and 1 dose after every diarrhea, maybe with 1 dose itself, there may be no diarrhea, no fever, no weakness. We need not repeat every 5 minutes, every 10 minutes, every 1 hour. Wherever this is possible and the remedy is right and patient is showing result and traveling in right track, this I continue. If not, I quickly repeat. Okay. So where result is there, on giving first dose remedy, patient started improving progressively, I just wait. The advice given to the patient is, if diarrhea repeat, take next dose. Then what happens is, instead of 2-hourly diarrhea, it becomes 4th-hourly diarrhea. The quantity becomes less, the weakness is less, and the pain accompanying is also less, if at all it is painful. Okay. So for dose adjustment in acute or chronic, I use the episodes. So with that, what happens is, the duration of recovery is less, the dose required is also very less. Instead of any mechanical repetition or formula repetition, this I have tried and it works wonderfully, not only in acute, but in chronic also. So sulfur helped the patient. Okay. Case number 6. Patient says, doctor, my nose is running profusely and the discharge is like water. It is running like anything and there is fever. Okay, that's all, nothing else. Now the exact reference is here. See the interesting chapter. This I call as breach. Instead of fever chapter, you see this. Under fever, you don't find this. So this I call as breach. the reference is go to nose chapter. Subchapter is coryza. Rubric is fluent. In bracket, you find the coryza is watery and thin and with fever, fever with. Nose, coryza, fluent, fever with. It is so amazing that such so-called simple, casual, common expressions find exact match in the repertory and materia medica. So, NER repertory, chapter is nose. Click open nose chapter. Subchapter is coryza. Rubric is fluent. And that with fever. The remedy is spongia toast. On giving spongia, the coryza stopped and fever is gone. One another important thing that happened with some of my patients. If my remedy is partial remedy or sometimes an incorrect remedy, the coryza stops, patient develops cough without expectoration. Then the direction is wrong. If coryza stops, it should not produce cough. Okay, then the remedy is wrong. Then the totality should be changed to cough totality. Give a remedy, and then cough will stop. Coryza may come or may not come. If cough stops, coryza comes, that disappears on its own, the remedy is good. Sometimes even without producing coryza, cough will stop, fever will stop, and patient will improve. So this is another important lesson I have learned in practice. Okay, so the remedy should remove these symptoms, and if our remedy is wrong, incorrect, the dose is too much or potency is inappropriate, it may produce such wrong direction of symptoms where you have to immediately recognize it, change the totality, give the remedy, and see that the patient improves in all aspects. Okay, so that is a very brief idea about NER repertory. What I sincerely recommend to all participants is, even to the organizer, another interesting case I will tell you. I found treating animals much easier than human beings. I'm just telling in a practical sense, not that treating humans are difficult, because if the caretaker of the animal is a reasonably good observer and able to say things in a nice way. One of my friend telephoned me and said, it is not in the chart, but I will tell you, you can see in the screen. Srinivas, we have a cow which has just delivered a calf, and the udder of the cow is very small. Usually, the udder becomes larger and larger and larger as the parturition is due. And after the calf is born, there will be milk secretion. It is not taking place. The udder is small, milk secretion is very scanty. The calf is struggling with hunger, and veterinary doctor could not help. Can you do something? This is the observation. And the beautiful point here is the udder is small, milk secretion is scanty. That's all. Okay. This looks, array, what is there? What is homeopathic in this? Very casually. Now, this has an exact reference. Please go to NER repertory. You will find such wonderful reference. The chapter is pregnancy, parturition, lactation. Please find after female genitalia. Pregnancy, parturition, lactation. Such wonderful chapters are there in this repertory. Click open lactation. And under the subchapter lactation, you find milk, scanty, mammae, small. Chapter is pregnancy, lactation, parturition. Subchapter is lactation. Rubric is milk. Subrubric is scanty. Sub-subrubric is mammae, small. Perfect. The remedy is calcarea. This is what my friend told, no? The cow gave birth to a calf and it is in the lactation phase. Milk secretion is very less and the udder is very small. That's all. And on giving calcarea, the milk secretion increased very quickly and within 3 days, the udder of the cow enlarged proportionate to that situation and milk secretion was adequate. There is no interpretation and no laboratory test, no ultrasound, no X-ray, nothing. There is a very, very visible proof. That is fantastic. Okay, so what I suggest is, these sessions gives you an idea that these things are possible. So this should be followed by systematic learning of this repertory, systematic learning of concepts of this repertory, and to learn more cases and difficulties in finding a rubric and remedy, how to see that in herring guiding symptom materia medica, confirm the rubric, prescribe a remedy, and then what to do if this is not helping me. So all this we have to do in a more and more systematic way. So what I request IFPH organizers, if you can parallelly, along with these sessions, if you want to organize such programs online of learning KNERR repertory in a more systematic way. All I have shown is very simple expressions of patients, casual expressions of patients, seemingly common symptoms. Whether you practice in city, whether you practice in a town, whether you practice in a village, whether you are in government service, whatever it is, KNERR repertory, such repertorization technique will help you a lot. Okay, so if there is any question, we'll discuss for 10 or 15 more minutes.
Yes.
Then close the session.
Exactly, a wonderful session. No doubt about their potential. Srinivasan sir is always doing the same thing. Now I shall close the screen sharing. Time for discussion. Those who would like to participate, please raise your hand. We all know that the potential of Constantine Herring and his work, the monumental works, I must say, the 10 volumes of the Herring's Guiding Symptoms, the textbook of materia medica. So Sridhar sir, definitely he will be fascinated. Sir, please, you can unmute now. Yes.
Yes, Dr. Srinivasan, a big salute for you, sir. Yes, I am using since 1986, but when I may not get from Kent or Bonington or some other repertory, example that the Bharat repertory, I may not get, then I may go to there. Anyway, I was getting result, but I was not that much knowledge regarding this much, because Dr. Divan Harichand was once told me. I searched into the other repertory, I couldn't get. Then some few symptoms. That time I was doing this thing, I was getting very fantastic result. Thank you very much, doctor. That come again. You are always a rare, uncommon, peculiar doctor in our this forum. Come again, and such tricks that it will be very useful to the everyone, especially for the new generation doctors. Thank you very much. I'm giving a big salute for you. Thank you, sir.
Okay, thank you, sir. Now, Dr. Aravindashan, what is your opinion? Dr. Aravindashan, please unmute.
Sir, good evening, sir.
Yes.
Sir, He gives me a wonderful class when I am in PG practice of medicine, Sarada Krishna, in the first year itself. From on that day, I have started using the NER repertory. So that's why I give an opinion for to which I will be fluent in that using that repertory. That's why I keep the shortcut of the NER repertory in my friend mobile desktop, because for all my cases, for about 90% of cases, I'm using only NER repertory in my private clinic. The last 2 days back, my wife was in a sick stage, and I prescribed her Eupatorium perfolatum, the symptom which I can be explained later time. She get relief within 5 minutes. That is Srinivasan sir's prescription, which I am following him from the PG course. Thank you, sir. Thank you for once again giving us such a wonderful class to the juniors as well as seniors, whoever may be in the class. Okay, me too have many case discussions regarding the repertory. We will meet you soon, sir. Such a wonderful class, sir. Thank you, sir. Thank you.
Yes, thank you, Dr. Aravindasan, for participating as well as sharing, helping to share the screen. Now, Dr. Veena, another talented personality of this IFPH. Dr. Veena, please unmute. Yes.
Good evening, sir. Really very thankful to you for this wonderful session, sir. So I have two doubts. One is in fever chapter, I have already asked you, but still, one is there are two rubrics. One is chill and one is chill. I just want a quick differentiation if possible. And one more thing is, you told you are not using the diagnosis in the repertorization chart. So is it only for fever cases or other cases also, or it is only for NER repertory or other repertories also? That is my doubt, sir. Thank you.
So, question number 1, difference between chill and chilliness. I can give direct answer, but what I want to do is to tell you the clue to not only you, for anyone who is here, how to find answer when the teacher is not there. The simple technique is not only with NER repertory, any materia medica, any reference book. Okay. So this is what I do in all my workshops. One is giving direct answer. Second thing is how you yourself can find an answer. For example, you go to fever chapter, chill subchapter, and open rubrics and see some 5 rubrics with single remedy. Read those things in hearing guiding symptom materia medica. That is step number 1. Step number 2, read chilliness rubrics, 5 rubrics with single remedy. And read all those things in hearing guiding symptom materia medica. So this way, what happens is